Hi, and welcome to another episode of Fay at Five. I'm LaTangela Fay, your hostess, and you know it does my heart well to have those in the hot seat and on the tan line that's doing some amazing work around the world to make the world that we live in a better place. Now, her title is long, but I'm telling you, it is effective, and she's getting it done. None other than Rhea Farberman. How are you?
I'm good. Thanks for having me today.
Anytime. I want you to think of this as an extension of your office. You have a lot of research that you're conducting, and a lot of these numbers are impacting us, especially our state. And it's one of those conversations that we don't like to talk about because here in Louisiana, we celebrate everything with food. If we're happy, we cook. If we're sad, we cook. If it's a celebration for any reason, we cook. And chances are we're not adding the right things to the menu when we're cooking, and we end up on your list of this research. Now, as the Trust for America's Health Director of Strategic Communications and Policy Research, tell me a little bit about your position.
Well, I work for, as you say, Trust for America's Health. We are a nonprofit, nonpartisan organization located in Washington, D.C., and we strive to promote those policies that are going to help all Americans lead healthier lives.
Right, and that's important. And I know during some of the reading in your findings, there are 16 states that are really leading with adult obesity. Give me a couple of those states.
Sure. We've done this report for 18 years. This is our 18th year of tracking obesity nationally and by state. And Louisiana has a obesity rate of 38%, adult obesity rate, 38%. Almost 4 in 10 adults in your state have obesity. And you're one of 16 states that have obesity levels over 35%. So it's a continuing problem, and it's been made more serious by COVID.
Absolutely. And you know, when you start talking about the adult obesity, you have to talk about the children's obesity because the parents are leading the way in the homes and they're conducting whatever it is that's on the menu for that night. And you know, it's not the same as when I was growing up. Whatever my grandmother or my mom or my grandfather cooked, everybody ate it, right? Now you see a fast food restaurant on this block, you see one on this block, someone wants a pizza on that block, and between $10, you have a feast for the family of nothing but junk food, but it's so convenient and it's the lifestyle and the culture now. How do we start creating those better habits to get us off of the sweet or unsweetened 16 list?
Well, you said so many important things in what you just said. You know, if you live in a community that has more fast food restaurants than whole service supermarkets, you're at a disadvantage because you're right. Fast food is less expensive. And for some families, that's a priority. If you're food insecure, if you've lost your job due to COVID, your family budget is under a lot of pressure. So sometimes you need to make the choice that's the less expensive choice. Unfortunately, very often the less expensive choice is also the high calorie choice and the less nutritious choice. But let's work with communities, with governments, with the food industry to try to make sure that we set the conditions in people's lives where they are able to make healthy food choices. You mentioned parents, and parents have a role to play, but I don't want to blame parents only because there's so much, it's a complex issue and there are many sectors and many organizations that need to help in addressing this obesity crisis. Government has a role, individuals and families have a role, the food industry has a role, the education and transportation industries have a role.
Absolutely. And you know, when we start talking about the policy and the government having a role in this, or even the restaurants and those who are providing the food, let's just say that we go into our favorite restaurants. As soon as they start the portion control, because you'll notice this as I travel, especially as I'm coming towards Washington or going towards New York, the portion is completely different. The menu, the options, completely different. You know, so when you travel from Washington to Louisiana, and they give you some etouffee, you're sitting here with your eyes wide as day because it's like, wow, this is a feast in one sitting, and that's just the first course. Whereas you travel other places and you see the difference. How do we start that cultural movement from state to state? Because we have to do something to get the lines together.
Yeah. Well, I think education is part of the solution. We have to educate people about what is an appropriate portion of food and how can they, and you know, we're not asking people to deny what they like every single day for every meal, but make healthy choices when you can. cook maybe a little bit differently, substitute ingredients in recipes to make them healthier, but also have some physical activity as part of your day. We like to encourage all communities to have a park, to have walking trails and bicycle trails. One of the recommendations in our report is that the school lunch program be made available for every student, regardless of the family income.
Yes.
So every student has that nutritious meal at midday at school. That's so important to get them on, create healthy eating habits, and to make sure that they're getting good nutrition during the day.
Right. And how young is too young to start having these conversations? You know, you don't want your children to feel as if they're being deprived, but if you want them to start making those healthier choices, because it is a lifestyle that we become accustomed to, that's why as adults, we have such a hard time letting things go.
Yeah, yeah, that's a really good point. And I think that what parents can do is normalize reaching for that piece of fruit instead of the cookie or the cake.
Yeah.
Make healthy choices available in the home, so kids do get in the habit of, I'm going to have a piece of fruit. And also get outside, get some exercise, make exercise part of your day, because it's really a combination of both making healthy food choices and being physically active.
Right. When we start talking about obesity, it's not just about the numbers that's tilting the scale. We're talking about the health factors and different roles that may even play. You know, our employers, they're starting to look at different factors. COVID has made us a lot less active because we can't get out as much. Um, what are some of the other leading factors that play a role with the obesity rate?
Yeah, it's a great point. I'm glad you brought it up because it's more than just a cosmetic issue. We spend $149 billion a year in this country on healthcare that's related to obesity.
Wow.
So if you are obese, you're at a much higher risk for cardiac disease, for heart attack, for stroke, for certain cancers, for arthritis, for needing a joint replacement. So we're spending a lot of money on the impact of obesity. Our thesis is that if we invest more now in obesity prevention programs and health promotion, we can save money on healthcare dollars in the future.
Right. I know you've been working with this for some time. You all have been conducting research and compiling this information. What has been the fork in the road for you? I know that you're getting the information, you have a lot of the solutions, but what's that one hurdle that has been the hardest across the board, not just with the sweet 16 states, but
Yeah.
in general?
Yeah. Well, as you say, we've been looking at these numbers for 2 decades, and they've been going in the wrong direction for 2 decades. And obesity just continues to increase in every state and across the nation. I think what's frustrating for us is that we know what the solution is, and that is investing in health promotion programs and obesity prevention programs. Right now, for instance, the CDC has a strong program that helps prevent obesity, but the CDC only has funding to put those programs in place in 16 states.
Okay.
We need to have that program in place in all 50 states.
Right.
So funding is part of the solution. And some of the things that were done during the pandemic to ensure that people didn't go hungry, like the school lunch program, free for all students that I referred to earlier, that needs to be continued even beyond the pandemic.
It does. And, you know, we never really noticed how many broken systems we had until all of the systems broke at once. You know, and so now, whereas if we needed help, the help was there to help us, but now the help needs help. You know, so this pandemic has put so many different issues on everyone's doorstep at the same time. It's like that big bruise that we all have to just sit and tend to. And obesity is a problem. Yes, we have higher rates in 16 states, but if all of the states are going in the wrong direction, surely we need to get the message out. We all need those accountability partners. During this pandemic, I spent the most time with myself than I ever have, right? So I'm thinking, Tan, you got to get it together. Some stuff I like, some stuff not so much. So I started asking the questions. Did you get your steps in today? It's mental, physical, spiritual, because this is a journey that we have to embody, you know? So every day won't be a perfect day on the plan, but if we make those small steps, hopefully we'll make your research a lot easier.
Oh, I agree. If it's, as you say, if obesity is a problem in every single state, then it's not something that a particular person or a particular community is doing. It's something baked into our society because it's a problem everywhere. Right. So what are those problems? What's associated with obesity? Well, poverty is one thing that's very much associated with obesity. So, as we build back from this pandemic, let's build back in ways that address the social conditions in people's lives that made the pandemic worse in some communities, particularly in Black and Brown communities, and made obesity a bigger problem in those communities as well.
Right. Now, are we seeing this more so within the Black and Brown or gender roles, or in particular when you start breaking it down for the research? How are those numbers stacking?
Yeah, of Black adults, we're at about 50% of Black adults in the US have obesity, and Black females lead obesity of all the demographic groups. Wow. Latinos are second at about 45% of Latino adults having obesity. Whites, about 42% of white adults have obesity, and then Asian adults, about 17% of Asian adults have obesity. And again, it's connection to the social factors, because why do Black people have more obesity? Because they have higher poverty rates, and poverty is associated with obesity. So, it's not just getting people to eat the right things, it's putting the policies in place that allow people to make those healthy choices, like a living wage, and helping people get the right education, to get the right job, to enable them to feed their family with a nice, nutritious meal at every meal.
Yes. All of this is some really great information, and it's not a conversation that we should just have once and it's just swept under the rug. So as often as you'd like, you jump on this tan line, we'll get the message across. If you have any websites or any literature that you'd like us to post, or even if you have any of those challenges, I'm here for it. I'll lead the way with you, because 'tis the season. We all have to be accountable. And I really want to challenge all of my viewers and my listeners to lead healthier lifestyles. And that's self-improve before we help improve, right? So with these numbers being as alarming as they are, you just dropped a ton of bricks. So if today isn't the day to make the change, I don't know what will be the day,
Yeah. Well, thanks so much. I've enjoyed the conversation. I do want to encourage your listeners to go to our website at tfah.org. The full report is there. But I also want to say, just in closing, that I don't want to put all the onus on the individual. We need government to step up as well. We need the food industry to step up as well. This is really a very complex problem, and people need help ensuring that they can make the healthy food choice and do have an opportunity to get some physical activity. It's really, it's a multi-sector solution is what we're after.
It is. And thank you so much for taking time out of your schedule. I appreciate it. Wow. Thank you again so much to Ms. Rhea Farberman for taking time out of her schedule to enlighten us on the numbers, knowing our numbers, and having a plan. Now, of course, accountability, it's across the board, starting with self, our families, our loved ones, our communities, and as she mentioned, the government, and of course, all of these establishments that also play their role. Now, of course, I want you to keep it locked right where you have it. We have more details coming up and more helplines. And this is a conversation that I would love for you to chime in on. What are some of the baby steps that you plan to make, along with your family, along with your friends, to make this world we live in a better and healthier place? Be sure to join the conversation with the Twitter alert at LaTangelaFay. And all of my links are posted at LaTangela.com. Now, I got some work to do, including getting up and getting my steps in. Hey, chase the sun, or let the sun chase you. But either way, get after it. I love you, and there's absolutely nothing you can do about it.